Welcome to WSIC Integrated Patient Summary demonstration video. The Integrated Patient Summary dashboard is available for WSIC users with a PID access and is a part of WSIC patient selection dashboards. There are two ways of accessing this dashboard. User can type a patient's NHS number on the landing page and will be provided with a link to the Integrated Patient Summary for that specific patient. The Integrated Patient Summary can also be accessed from any of the patient selection dashboards, for example on the watch list, hover over the patient data to see a link to the patient summary. The Integrated Patient Summary dashboard is a useful tool providing visibility of patient activity across all care settings, regardless of source of the clinical system and without requiring manual data collection. The dashboard helps reduce reliance on hard copies of notes, manual data access, and tracking by aiding continuity of information between MDT members. The Integrated Patient Summary dashboard consists of Activity Summary, Patient Spend, GP Activity, GP Prescriptions, Social Care, Acute Diagnosis, Acute Procedure, and Patient Profile. Activity Summary dashboard. This dashboard helps to track the patient's activity across all care settings for a period of time selected in the top left corner with a maximum up to 2 years' time. Below the patient's details, care home flag will appear if a person is in a care home. You can also decide if you would like to view costs associated with the patient care. Please note that cost in this context is considered more as an indication on activity rather than a real cost. In other words, financial values represent commissioner's cost and includes estimates or averages where payments are not linked to specific patients. For more information how the patient spend has been calculated, please refer to the Care Professionals Dashboard User Guide, which can be accessed from the WSIC website. Below, all long-term conditions the patient has been diagnosed with are listed. The long-term conditions are based on the QOF algorithm. Hover over each long-term condition to see date of diagnosis. Next to the list of the long-term conditions, the patient activation measure information is displayed. Just a quick reminder what the PAM is. It is a 100-point quantifiable scale determining patient engagement in healthcare. The measure will be displayed on the dashboard provided the PAM data have been recorded in the GP system. The segment on the right-hand side displays information about the patient's frailty status, which is based on the Electronic Frailty Index. The Electronic Frailty Index is a tool which helps to identify patients as they progress through different levels of frailty. It uses a subset of codes to interpret 36 deficits. The score determines whether a person is considered fit, mild, moderate, or severe. Click on the EFI to open a new page which displays list of all deficits present for the patient. Above the EFI, number of days not in hospital and total spent are displayed. Days not in hospital is defined as the number of days in time period minus the number of days as elective non-elective inpatient. Finally, the user can find out if the patient is a community mental health or social care user, if has a care plan, and if this care plan is up to date. The middle section of the dashboard displays patient's activity within different service settings over a selected period of time. Hovering over a swimline will provide the user with more specific information regarding the activity. The colorful little boxes below the swimlines graph indicate activities category. For example, orange states for emergency support and purple for planned acute hospital care. You will notice that this color coding applies to all dashboards within the Integrated Patient Summary. By clicking on the calculator icon at the bottom of the dashboard, you will be taken to the Patient Spend page. Patient Spend. This dashboard provides a graphical presentation of a patient's cost over a selected time period. Filter the date range shown by using the filter in the top left-hand corner of the screen. The costs for each category of care are shown against the bars in the lower section of the dashboard, whilst the total of all these costs are shown in the graph in the middle section. Please refer to pages 21 and 22 of the Care Professionals Dashboard User Guide to understand how these costs are calculated, as well as the caveats that apply. Hover over a section of the graph to display more information about the total cost of patient activity for different care settings over time. GP activity. This dashboard allows tracking patients' read-coded primary care activity over a selected period of time. Use the drop-down menus in the top left-hand corner of the screen to filter on GP events occurring within your chosen time period or within a particular group of read codes by hierarchy groups. Use the event dates located at the bottom of the screen to easily view a patient's primary care history. Clicking on the individual event or the whole row will display more details. GP prescriptions. The dashboard allows viewing patients' prescribed medication in primary care settings. You can filter the medications that were issued only in the past 3 months, or view all prescriptions made in primary care. The number of drugs currently prescribed means the number of distinct drugs with last issue date within 3 months of the most recent data point in the dataset. The issue type specifies if the prescription is acute, a one-off prescription, or repeat, intended to be given again. Prescriptions can be sorted in chronological order or by a drug name. Social care. The dashboard allows viewing patients' social care services over a selected period of time and under different categories of care. Primary Special User Group displayed at the top right corner provides an indication of the reason for the patient's social care support. Hover over an information icon to find out about the list of primary special user groups, as well as other useful information. Please note that additional special user groups may be in use by particular local authorities. Activity is shown in streamlines so that you can view services against a timeline. Hover over the service to see the provider, start date, and service type. Acute Diagnosis. This dashboard allows tracking patients' acute diagnosis displayed in ICD-10 groupings over a selected period of time. ICD-10 code is the international classification of diseases used to classify diseases and other health conditions. Use the drop-down menus in the top left-hand corner of the screen to filter on acute diagnosis having been made within your chosen time period or within a particular group of ICD-10 codes by hierarchy group. The number of diagnoses is defined as the number of distinct diagnoses found across all acute points of delivery. Please note this will not double count diagnoses made in different PODs, like A&E, IP, or OP. Click on the plus sign to view columns with more details. Click on a row or event for more information. Acute Procedures. The dashboard allows tracking patients' acute procedures based on the OPCS4 groupings performed over the chosen time period. Use the drop-down menus in the top left-hand corner of the screen to select a time period or a particular group of OPCS4 procedures code. The OPCS classification of interventions and procedures is a statistical classification of intervention and procedures undertaken in NHS reflecting current clinical practice. The number of procedures means the number of all procedures found across each acute point of delivery. Please note this will count all occurrences of all diagnoses made in acute settings. For example, 5 MRI scans will be counted as 5 procedures. Clicking on the individual events or the whole row will display more details. Patient profile. The dashboard allows viewing a summary of patient's activity, current medications, and other key information. Hover over the eye icon to find out useful tips on the dashboard usage, calculation definitions, and information about the data provenance. On the left, you can find out activity by the care settings. Hovering over a bar will display further information, for example about the service provider. On the top right, a number of drugs prescribed within last 3 months is displayed. Click on a care setting on the left-hand side of the page to highlight and show provider information on the map. By clicking on a cross on the map, more detailed information will be displayed on the left-hand side of the dashboard. Click back on the map to reset the settings. You can download the data in various formats like image, PDF or Excel by clicking Download button and selecting the format you would like to obtain. This function is available on all our dashboards. Dummy data has been used throughout this video demonstration. To request an access or provide a feedback, please email nhs@nwlccg.wsic.dashboards@nhs.net. Thank you for watching.